Hi, welcome. I'm BJ Leber. I'm the president and CEO of Adagio Health, and this is our first post-pandemic event, live and in person. So it is really nice to see all of you on a sunny evening with people in the Strip. It's really terrific. So you are our inaugural live audience. You can carry that with you forever. We will continue to make this series, which is now in its third year, available via video and social media. And I want to thank our sponsors, many of whom began supporting this series back in 2020 when we did it as a reaction to the pandemic in hopes that we could find a way to continue to get information out to the community. And continue to promote women's health equity, and health advocacy. So first, our presenting sponsor this evening is the Highmark Foundation. We are so grateful for their continued partnership. And with that in mind, I want to welcome Kate Hancock to the podium to say a few words. Kate is a program officer for the Highmark Foundation, and she's also the newest member of the Adagio Health Young Leadership Council.
Thanks, BJ. You stole a little bit of my excitement about being back in person. I remember the first virtual series. So again, I'm Kate Hancock, Program Officer for the Highmark Foundation. And on behalf of the foundation, we're just so thrilled to be in person. And the series is so important to us as it relates to getting together with community, hearing stories, thinking about how we can move the needle and contribute to better health outcomes. So like I said, we're so glad to be here on behalf of the entire team, many of whom are here today. We thank you and we welcome you. Enjoy this beautiful evening. This is such a cool space, and again, can't wait to hear from KMU and Rosa, hear your stories, and it's been nice chatting with many of you already tonight, but thank you and welcome.
Thank you, Kate. Thanks, Kate, and once again, thanks to the Highmark Foundation, our presenting sponsor. We have also received generous support from PNC, Dollar Bank, Federal Home Loan Bank of Pittsburgh, UPMC Health Plan, Allegheny Health Network, and our good friends at Allies for Health and Wellbeing. So can we give them a round of applause? I know everybody in the room in some way appreciates how important that support is to these kind of efforts. And I want to thank our board chair, Betsy Benson from Pittsburgh Magazine, who is here tonight representing our board of directors. And also members of our advisory council, the members of our Young Leadership Council, which we've mentioned, and they both continue to enthusiastically support our efforts and events like this one. So thank you all for your support. You're going to hear from some amazing women tonight. Rosa Davis is the CEO of Power. I've known Rosa for a long time, and I'm so glad she's here to share her experience and insight around recovery with us. One of the things that I really like about Pittsburgh is there are people you have relationships with and you're not sure where they even started, and Rosa is just one of those people for me, and I'm really glad that she's in my life. Cambria King from UPMC Magee Womens Hospital is also with us tonight. She's a new friend. We are thrilled to welcome Cam and to hear her story of recovery and advocacy for moms, babies, and families. Before we hear from Rosa and Cam, I first want to introduce you to Adagio Health's own Becky Ludwig. Becky's our Senior Director of Integrated Services and oversees a unique program focused on preventing neonatal abstinence syndrome. It's a program that Adagio Health first began in 2020 with support from the federal government's Health Resources and Services Administration, also known as HRSA. We're really proud to be able to do this work. And so it is my pleasure to introduce you to Becky Ludwig.
Good evening, everyone. As BJ said, I'm Becky Ludwig, and I am thrilled to be with you tonight to talk a little bit about our neonatal abstinence syndrome grant. So in 2017, the Department of Health and Human Services declared the opioid crisis a nationwide public health emergency. One of the critical consequences stemming from the opioid crisis is neonatal abstinence syndrome, commonly referred to as NAS. NAS is a withdrawal syndrome that can occur in newborns if they've been exposed to certain substances during pregnancy, including opiates. Although the consequences of NAS span across the Commonwealth and the country, rural communities feel the burden disproportionately higher than in urban areas. In September 2020, Adagio Health received a 3-year grant, as BJ said, from the Health Resources Services Administration. The Rural Communities Opioid Response Program to Neonatal Abstinence Syndrome grant focuses on Mercer, Lawrence, and Venango counties. Our target population for the grant is pregnant women, women of childbearing age, and mothers who are at risk or have a history of a substance use disorder or specifically an opioid use disorder. Through the grant, we formed the Raise Hope for Women Consortium of community service agencies in our 3-county area. And we are extremely proud to have community treatment centers, Discovery House, Farrell, and Newcastle locations, Lawrence County Community Action Partnership, Mercer County Behavioral Health Commission, and the United Way of Venango County as our consortium members. Together, our mission is to reduce and ultimately eliminate NAS by partnering with insurance companies, neonatal service providers, treatment centers, and other community agencies working with pregnant women. Our project focus area is improving integrated care and care coordination through prevention, treatment, and recovery strategies. A few of our notable accomplishments throughout the grant I would like to highlight. Our medical offices can provide what is called a bridge prescription of Suboxone if we have a patient that wants to start the medication and we cannot immediately get them connected with a treatment center. Our providers can give them a script for Suboxone to bridge the gap, if you will, until their treatment appointment. We launched a successful anti-stigma campaign involving billboards and social media to show support, not judgment, for individuals with an opioid use disorder. With the support of Northwest Behavioral Health Partnership Health Choices, we also facilitated an extremely successful training for certified recovery specialists. The presentation focused on opioids and NAS, including treatment strategies and effects, parenting tips, and how to talk to clients regarding sexual and reproductive health, which is extremely important. And all of this was in an effort to support pregnant women in recovery. And last but not least, we designed this daily planner. I had to do a little show and tell because I'm very proud of this. It's for individuals in our target population being released from incarceration or inpatient treatment. It has local and national resources as well as inspirational messages of hope and recovery. So although we will be coming to a successful close of the grant in September, the valuable relationships formed, lessons learned, and our efforts to reduce and ultimately eliminate NAS will continue. So thank you.
Thanks, Becky. Nice job. I just want to take a minute to say I believe most of you here tonight are familiar with Adagio Health. This is just one of the many, many programs we have to make a difference. And our goal is to find areas where there are needs, both geographic areas and programmatic and service areas, and then do our best to fill them. And I think this is a great example. And as I said, we're really proud to be this work. And I know many of you are involved in the work or a partner in the work or a supporter of the work. And so thank you very much. And nice job, Becky and team. So now I get to introduce Rosa Davis. Rosa is the Chief Executive Officer of POWER, an organization whose mission is to help women reclaim their lives from addiction and related emotional health issues, and also to enhance the well-being of future generations. Under her leadership, Power has grown from a single program agency founded in 1990 to an organization that today offers a full range of comprehensive, gender-responsive, trauma-informed behavioral health treatment and support services for women with substance use and co-occurring disorders. Power offers screening and assessment, withdrawal management, inpatient and outpatient treatment, and peer recovery support, serving approximately 2,000 individuals each year. Rosa, we're so pleased to have you with us tonight.
Hello, thanks for having me. So I remember how BJ and I met. It was Jim Turner introduced us. I was trying to think about it too. I had reached out to BJ. She was going to help me just kind of think through some possible candidates for board. But at the time you were still at West Penn and you were working for the foundation, and I asked about the burn unit. Do you remember?
I do.
And so BJ graciously said, you know, there's a burn camp. Would you like to go? So I got so emotional and I was like, yeah, I want to go. I think I want to go. I never did anything like this because believe it or not, even I was in a fire when I was 14 months old, but believe it or not, I've never met anyone else like me. One time at Power actually, which is really interesting. But so BJ said, come to the burn camp. They're kids that go every summer. So we go the whole way up. And this does, believe it or not, relate to women in addiction, just about how different men and women are, right? And keep in mind when I say that, I know all women are not the same. I know that, but there are so many things we share, right, that are a little bit unique. And one of them is how we emote and how expressive we are and how we share. So the whole way up, we were having a good time on the drive, but would think about and talk about the burn camp a minute, and I'd get so emotional, I had a lump in my throat. I thought, what am I gonna do when I see all these kids, you know, that look like me? So we get there, we meet the first counselor, I don't know if you remember, and I was already choked up, like thinking, oh my gosh. And she said, the kids are up on the hill, or so they were gonna do a hike. So we walk up to the hill, well, there's no one there. Then all of a sudden these kids come out. These kids were beautiful. I saw not one scar. And I was happy for them, right? Their scars were probably not on their face or where you could see them maybe, but there was not one scar, and we were very quiet on the way back. I busted out laughing and I said, only I would go to a burn camp and still be the worst person looking there, right? It was so funny to me that I finally had this opportunity to meet these kids. I thought I was going to talk to them, and they were looking at me like, wow, I wonder what happened. And they were perfectly fine. So when I think of BJ, I think about her generosity, her kind of holding my hand on the trip up because I was so nervous, and then we just laughed like, okay, well, I got to get to the burn camp, and maybe one day I'll volunteer when I retire. How about that? So I tell that story and I think about how different women are from men. I don't know how men would have experienced that same ride up and same environment and same opportunity, but I suspect there are lots of differences between men and women, and we know that, right? You don't have to be in recovery, you don't have to be struggling with an addiction to know men and women are just different, and that's why Power exists, because men and women are different. So the issues that women face in their recovery are not more important or less important, but they're just different. So if you hope to hang on to somebody in treatment, if you want to engage them and keep them engaged long enough to make a difference, then you better be appealing to what matters most to them. So all of our programs at Power reflect the lives of women. Our staff are 98% women. Our environment, it reflects women's lives through literature, artwork on the walls, activities, curriculum, and it's just super important. And one of the things that's different, again, not necessarily unique to women, but certainly more common, unfortunately, in women, is trauma, particularly trauma that is sexual assault, early childhood sexual assault, partner violence, that sort of thing. Much more prevalent among women. Something like 80 to 90% of women who show up in substance use treatment centers also report histories of trauma. So our programs address trauma at every level, Every opportunity we have, to every contact we have, we always operate as if every woman in front of us has experienced some sort of trauma. So when you come to our facilities, hopefully what you feel is welcomed, accepted. You can tell it's a place that's inclusive and non-judgmental and warm and beautiful. And that's the way we like it, because our goal is to keep women engaged as much as possible. You heard BJ talk about our programs. We have a full range of treatment and support. You can read about that, so I don't want to spend a lot of time talking about that. Alicia gave me lots of ideas. She said today was kind of free-flowing and I could talk about whatever I want, but I liked every idea you sent. So I was thinking about what I want to share. One of the things Alicia said is, and then something Cam and I talked a little bit about, is harm reduction versus total abstinence, or just different pathways to recovery. We've come a long way at Power. It hasn't always been easy. Probably about 50% of our staff are in recovery. So we hire people with lived experience, not just in positions where it's required or necessary or helpful, but across the whole agency. And it is a wonderful, wonderful thing. And there are some challenges, because people in recovery tend to love the way they got their recovery, which makes sense, right? Because it worked for them. So we have to work really hard to make sure every person that comes to work for the organization knows that there are lots of pathways to recovery. There's medication, there's 12-step programs, there's other self-help programs that people may choose to go to. There's church, right? There's all kinds of different treatment levels. There is reducing your drinking or drugging, right? There is total abstinence, and that's not easy for everyone to step into and to work in that kind of environment. It's taken us a long time. In fact, when Cam and I started chatting a bit, I said, would you come and talk to staff? Because I think it's always really important for staff to be reminded of why it's necessary to remain open to all the possibilities and to really honor and respect a person's choice, a woman's choice, about what it is she wants to accomplish. What does she want to do? Does she want to stop? Of course, there's the part of me that hopes everybody chooses total abstinence, but if someone can reduce the amount of drinking they're doing and be healthy and happy, then what's wrong with that? If someone chooses medication, that's not only what's wrong with that, that is accepting what we preach, which is addiction is an illness, right? And in our own field, we forget that. We go around preaching against stigma and lecturing people about addiction, alcoholism, and other drug addiction, substance use disorders are illnesses that respond to treatment. But as soon as we mention medication for a chronic illness, people get uncomfortable, right? That can't be anymore. If we were being treated for cancer today, would we want treatment that was available only 20 years ago and not want to hear about and know about all the advances, right, that have come along? Wouldn't you want the most up-to-date information? So we say it's an illness and we continue to treat it like it's bad behavior and some sort of moral failure when it's not. If it's an illness, let's treat it like an illness. I know that it's complicated because there's bad behavior associated with untreated addiction, right? It's just that way. And it's complicated. And for someone who doesn't work in the field or hasn't had some personal experience, that gets confusing, right? And it's easy to fall back on, well, if they wanted to. I don't know anyone that wants to grow up and suffer with an illness that affects every aspect of their life, right? When I came to Power 31 years ago, I remember I thought I was the most objective counselor. I worked with kids mostly. I was a juvenile court probation officer. I worked in foster care. I worked in the school system. So I always worked with adolescents. And I never thought I blamed parents for anything. I thought I was really open and loved all my families, the kids and their families, and that I was very non-judgmental. And I think when I came to Power, I realized that there was a little bit of something that I maybe was doing or thinking about that I didn't realize, right? That maybe subconsciously I thought, well, it's not that kid's fault. So it's got to be someone's fault. So is it their parents' fault? And I'm so glad my life has come full circle professionally, because I remember being at Power, I think I was 33 years old, and we had payphones in the building still. And some of you may not even know what payphones are, but there were payphones in the building. And my office was situated at the bottom of a set of stairs, with the first payphone was right there on the landing. And I could hear this young woman talking to her daughter, and I knew she had a daughter, and her daughter was about 12 or 13. And I could hear her saying, "Oh, honey, don't cry. Don't cry. Mommy is so proud of you. You're being such a big girl. This time is so," I could still cry when I think about it. "This time is so important for Mommy, because I'm going to come home and we're going to be a family again. You know, Mommy, I'm so grateful you're giving me this time to get well." And in that moment, I finally got it. And I myself knew and always will believe that that mom didn't ask for that. She was devastated she had to leave her child behind. She was embarrassed. She was fearful about her future. She was grateful she had the support, someone who could take care of her child while she was in treatment. I knew that this was not something she asked for, and I'll never forget that. And it always helps keep me humble, keep me grounded, and remind me that when I'm going out preaching and lecturing people, that I have to remember that I believe what I'm saying, that I really believe what I'm saying. I know it to be true. It's proven. It's not my opinion. It's the truth. So I don't want to take up too much time. I want to be able to hear Cambria, and want you all to hear her as well. I think I just want to say that, and I don't know, I don't remember if you said there are questions and answers at the end or not. So or stop me, you know, when we're walking around chatting, getting something to drink or eat. Feel free to ask me anything you want. But I do want to say, and maybe I don't need to do this anymore. I always tell this story because I think that for folks, and probably not necessarily in this crowd, but it's a cool story, so I'm going to tell you anyways. But I think that oftentimes people, even though we know, especially with opioid overdose, right, over the last several years now, how can you have to live like in a cave to not know what's going on and to not know how prevalent it is? 1 in 10 people who drink will become alcoholic. 2 out of 3 families are affected by substance use problems. So it's not like something everyone shouldn't have heard about. But sometimes people tell me they can't relate. They just don't get it. And I think about when I started at Power, I remember it was probably my first or second year, a very generous donor sent us a gift card for a local restaurant and said, take the women out to a nice restaurant for lunch or dinner. So we did. And so we were just chatting, and during that chat there at the restaurant, I overheard a young woman say what her birthday was. So it turns out we were born on the same day, in the same year, in the same hospital in Rochester, New York. Now, what are the chances, right? So I picture these 2 babies, maybe even side by side in that nursery. Who would have thought that one would grow up and struggle with a lifelong addiction and end up at a treatment facility in Pennsylvania where the director was maybe in the nursery right next to her? So that always reminds me, it could have been me, right? It could be anyone. It could be me. And so really, I think most of all, when you are out and about living your lives and, the topic comes up, be an ally, be a friend, be informed, be an advocate, and help set the record straight. That treatment's not only available, but it's waiting for you, and that recovery's not just a possibility, it's a reality. And millions of people are living their lives in recovery. So thanks for having me, BJ.
So I want to thank Rosa, and I just want to underscore care, compassion, respect, sort of basic values that all of us want to exhume and have others, give back to us, and you exemplify it, but helping women through a really difficult journey. So thank you for that. And I will tell you a very quick story that relates. I was listening to you realizing our organizations are very, very much alike in mission and the way we deliver our services, our staff, the commitment. We had a young woman come into one of our medical offices a while ago who had flown in the day before from Hawaii, and she was about to give birth. She had had no prenatal care. She and her husband couldn't find care in Hawaii. We don't know to this day how, to your point, we don't know how they found their way to Adagio Health. We don't know how they found their way to that office, which was open and waiting for them with open arms. So the office was about to close. They closed the office. They kept the young woman there, did a full exam, connected her with a physician, and she's healthy. She had a healthy baby. But when she left, she was in tears. And she said to the nurse practitioner, "Thank you for taking care of me, but thank you for not judging me." So it's just so important to just open our arms and do what we can for these folks. So thank you for that. So let me put my glasses down so I can tell you good things about Cambria. Cambria King is a certified recovery specialist and senior peer navigator specializing in addiction medicine at UPMC Magee Womens Hospital. She has devoted her career to assisting others and significantly impact the patients she supports. Within her role at Magee Womens Hospital, Cambria is instrumental in guiding patients through their recovery journey. She's an integral part of the pregnancy and the Women's Recovery Center and a member of a consultative service that provides comprehensive inpatient support, which encompasses recovery planning, tailored education, and ongoing support. Driven by a passion for educating others about substance use disorders, Cambria draws on her personal experiences to help bridge the gap between clinical care and patients. Her active involvement in community outreach and education enables her to make a tangible impact by raising awareness and providing support to those affected by addiction. Cambria, welcome.
Hi. Thank you very much for that wonderful introduction, and it was lovely hearing you speak, and very, very powerful and moving. I appreciated that. So as everybody has said, I'm Cambria King. I am the Certified Recovery Specialist and Senior Peer at Magee Womens Hospital. But more importantly today, I stand in front of you as a woman who has walked the journey through addiction and opiate use disorder, and reclaiming my life, and coming to find my voice to help others and other women. So my story, how did I get here? And that starts in Western Pennsylvania, in Sarver. That's where my biological mom was born. She was only 18 years old when she became pregnant with my older brother, Eric. At that time when she became pregnant, my biological family is a really, really nice family. They're a good family, but there's a lack of understanding. There are very deep-seated feelings about addiction and mental health. And in my family and in my biological family, it went untreated and undiagnosed. And it was more of who you are as a person, and you have control over this and yourself and your life. And for my mom, Jody, her becoming pregnant was an indication that she was now an adult, and that she would be on her own. So my biological family set her up and moved her out of the home, and really financially and emotionally left her. And so she was very much alone to deal with being 18 and pregnant. My brother Eric was born in 1982, and I was born 20 months later. Things had spiraled for her, and she found herself struggling with drugs and alcohol, and became unexpectedly pregnant with me. And when that happened, she met my adoptive parents, Bill and Faye. And that's when they came into my life, even before I was born. They met Jody, and she had dated their adopted son, Jim. And she said, thought Jim was my father. And so Jody became like a family member to Bill and Faye, and they took good care of her. And when I was born, they were very involved in my life. My adoptive mom, Faye, has red hair, just like I do. And so we really have always had a bond. And for the first 3 years of my life, though, was very inconsistent. I did not have consistency. I did not have stability except for when I was with Bill and Faye. And so I spent those years developing codependency and thinking that when I was with Bill and Faye, I became a people pleaser because I wanted to be the perfect child so that they would love me and keep me and give me that stability all the time. And that's what happened, thankfully. They fully adopted me. They won against my biological mom in court. They went to court. In 1986, they adopted me. And the next 18 years of my life, or 15 years at that time, they gave me the most incredible childhood. And they are very instrumental in my life today. And they're huge supports. They fought for me through my childhood. I struggled with ADHD. That's one of the driving forces in my life of when things go wrong. And they were always there to pluck me out of trouble. I had tutors, I had therapy, I had medication, I had all of the structure you could ever imagine, and I did really well. I graduated high school with above a 4.0. I was part of the National Honor Society. I had a bright and promising future. I had been accepted into Penn State University, Maine, and I was on my way. And my dad and mom were so very proud of me. My dad, growing up, he is a university professor at University of Pittsburgh. He was a graduate professor there for 40 years, and my mom was a stay-at-home mom. So when I went to college, I grew up as an only child with them because they had adopted me later in life. So when I went off to college, I'll never forget them sending me off and saying goodbye, and I was free. I didn't have my dad with a curfew or what time to come home and those sorts of things. And that freshman year is really when that marks the start of my substance use disorder. And at Penn State, sororities are a really big thing, and drinking and binge drinking. And during that time period, I was medicated all my life for ADHD. And I had never even thought about misusing my medication until I got to college. And somebody was like, hey, you know, you can use those to like have fun and go out, and by the way, can I have some to study as well? So I met a lot of people, I made a lot of friends. I was called, you know, in kindergarten, they called me the social butterfly. So I was the life of the party. And it was very normalized. And while I had this idyllic childhood and these amazing parents, there's always dysfunction underneath. And pill taking was very normalized in my household. My mom had a book next to her bed that she would keep, and she was self-diagnosing. And we had friends in Mexico, and she would have them send us, you know, over-the-counter, you know, things that we couldn't get over the counter here, and so forth. So it was very, very normalized. And also, I talk about my privilege and the fact that in college at this amazing university, it is encouraged to drink. I was taking 10 shots right off the bat as an 19-year-old girl. I am so thankful nothing really bad happened at Penn State. So I floundered and I really struggled. But my privilege is kind of what was my safety net. My parents were always there to pick up the pieces. They were always there to pay the bill or to get me out of trouble if I just wasn't thinking clearly. But when I met opiates and when I met my significant other, my family could not save me from an opiate use disorder. And in 2011, I was 28 years old before I had tried an oxy or whatever it was. So up until this time, I had struggled with substance use. And I think if I didn't have the socioeconomic background in the life that I did, I wouldn't have even made it that far. But I met Bailey, and that's when my codependency met his opiate use disorder. And they go hand in hand. And I don't think a lot of people talk about codependency and drug use. But it was my driving force. And so when I tried the drug with him that night, it was just like any other night. I was a young professional in Pittsburgh. I worked 4 days a week as a nanny. I went out with my friends for the other 3 days. And we partied all around Pittsburgh, and it was a great, fun time until I used an opiate. And I didn't understand the effects that it has on somebody's brain who has these pre-existing conditions, these pre-existing things that put me at risk for developing an opiate use disorder, like my ADHD, like my codependency, like my trauma. And so when I used that opiate that night with Bailey, it was a great feeling. And it felt manageable. And it felt like just like every other drug I had tried up until that point, because I had tried a lot of them. And it didn't really seem any different. But a month after that, I quit my job as a nanny that I had had for the last 4 years. I emailed them because up until then, everything turned to opiates and to trying to get that feeling again. And it's always manageable in the beginning. And I didn't notice the focus or the change in the way I was behaving and what I was doing and how I was thinking. I say this, it was a blessing and a curse. I got pregnant unexpectedly with my son, Colton. I was not yet dependent on opiates, but it didn't mean that I didn't have an opiate use disorder or a substance use disorder. I was able to stop using opiates and to get healthy during my pregnancy, but at the very same time, my significant other, the person I was so in a deep codependent relationship with, was at the pinnacle of his addiction to opiates. And so when I found out I was pregnant, he had hurt his foot, and that became his excuse to use opiates. And the stress of me finding out that I was pregnant in this unexpected pregnancy. And so I enabled him through my entire pregnancy. And no one in our life knew, by the way, no one. So all of these things are happening, and my parents and everyone else in our life think that we live a very normal, happy, drug-free life. You know, they know we go out sometimes, but they have no idea. They have no idea that during that pregnancy, I spent about $15,000 to $20,000 on Oxy 30s. And by the end of my pregnancy, that's $30 a pill, and he would need about 5 of them a day. And so when I talk about my privilege and my socioeconomic status, the fact that I was able to maintain that and live a normal life is very rare, not normal. So that's why I speak about my privilege and how different my experience was, different but the same. And so while he excelled and his opiate use disorder went to the max, I struggled alone, and I had no idea what to do or why I could not let this man just go into withdrawal. Why couldn't I just let him go into withdrawal? He can stop using. I'm not even going to get sick. I didn't even understand why I was so not able to let him suffer in that way or see him uncomfortable in that way. And so I enabled and I enabled and I enabled because that was the easier thing to do. It was the path of least resistance. And so at the end of my pregnancy, I had blown through all of my savings and all of these, and I'm expecting a baby. And so it's not one of joy and excitement. It is terror and uncertainty. And right before I had the baby, we couldn't afford those $30 pills anymore. And so it was getting harder to find things to keep him normal and comfortable, because remember, everybody doesn't know, so he can't be sick. It's not like we can tell anyone that this thing is happening. So we're keeping up the ruse. And he comes home with a bundle of heroin, and I'd never seen heroin before. And I was concerned, and I must have had a look in my face, and he's like, it's just the same as Oxy. It's cheaper, it will keep me okay. And by the way, when someone is in that maintenance phase in opiate use disorder, they're not getting high. The high part comes in the very beginning, and it's a very short period of time. The way that our brains work and the way that tolerance works just does not allow you to enjoy that for any extended period of time, and it very quickly becomes like handcuffs, like you are a slave to this drug. And so at the end of my pregnancy, this happens, and I'm just beside myself. And I go and I deliver my baby, and unbeknownst to me, no one at the hospital knows, right? I've never had any urine drug screens or anything like that. And no one knows our history or anything like that. And so when I deliver my son in the recovery room, the nurse asked me, would you like Percocet or would you like Tylenol? And I said, oh God, Percocet. I just had a baby, and so that led to the Percocet and then a prescription to go home with. And in the very same time, I'm at this high risk for developing, already have had an issue with opiates. Here I am in this vulnerable space, but nobody knew better. And so I went home, and at that same time, I knew something had to change with Bailey. We could not be doing this. So our idea, it was a missed opportunity for him to get onto medication for opiate use disorder, because that wasn't even an option at the time, because that's not the right way. That wasn't being sober. You had to do it the right way. You might as well just keep using, in our minds. And so he didn't go and get on methadone, and he didn't get on Suboxone. He went to CPCDS for ambulatory detox. And I decided that I was going to try to go to my parents' house to go away to not enable him. We had it all planned out. And we wanted it so bad. We wanted it so bad. We wanted to be the perfect family. We wanted to be happy, and we didn't want to have these drugs in our life. But about 4 days into that, at this point, I'm dependent on opiates physically, because I've been taking Percocet every day, plus whatever my mom had in the house. So 4 days in, and he calls me, and my significant other is crying on the phone, and he's asking me, he's rationalizing, his brain is rationalizing one more bag, one more time, and it will be okay, and we will stop, and it'll be okay. So I left my newborn baby with my parents, which they loved. They wanted to be around him all the time. And I went to pick him up, and we drove to the person's house. He got it. And we're sitting in a Wendy's parking lot. And that is literally the first time that I've ever tried or did a bag of heroin. And that was one bag of heroin. By August of that year, I was using 50 bags of heroin a day. And no one in my life knew. No one, not one single person in my life knew, but Bailey and I knew. So we struggled and we muddled through that summer, keeping up this ruse. And at this point, we had sold his car. We were selling my mom's jewelry, doing things that were very much outside of what I felt comfortable doing, but we were desperate. And I think now, what would I have been like if I didn't have anything at all? And so at the end of that summer, ironically, the person that we were getting drugs from suggested we go to the methadone clinic, because it wasn't to get into treatment and it wasn't to get into recovery. It was so we didn't need to have opiates every day, because we were actually very, very sick of it and we didn't want anything to do with them. And we just wanted something to relieve us of this burden, because it definitely was not fun. It stopped being fun a long, long, long time ago. And so we went and we got on methadone, and that was in 2012. And it worked great, but I had no intention of saying I was in recovery or acknowledging that I was in recovery or I had an issue, because it's just so crazy how you can be in that moment and not think clearly in that way. And that is the testament to this is a brain disease, and it changes the way you think and rationalize things. So we were good. We were really good. Methadone works really well. It was like magic. It literally, I remember the feeling of not having to go out or do anything and get anything, and we could just go to this place and get our medication, and it was like magic. It was like, I still use those words today when I talk to my patients. It's gonna be like magic. and it is. And we were good and solid for 2 years, but we didn't put in the work of being in recovery. And when we missed a day at the clinic in 2014, that was what spiraled us into a reoccurrence of use, because it was a weekend and I had no idea, again, how your brain rationalizes things and how it changes and skews your ideas and judgment. And so for us, that was an excuse and a reason to go get something to keep us off sick through that weekend. But of course, we hadn't used for many, many years. So there was that warm, euphoric, fuzzy feeling. And that's the rationalization comes back, and it led to an entire year of reoccurrence of use, which of course ended in me getting unexpectedly pregnant. Now this time, I'm on 70 milligrams of methadone, and I'm using on top of that. And I am absolutely terrified. And I talk about my maternal brain, and every single person is different, and everyone has a different story. But I'm thankful for my maternal brain. When I got pregnant with both Colton and my daughter Grace, and all my pregnancies, I really am very one-track minded and hyper-focused on my pregnancy and my baby and the outcome. And in that moment, the game was up. I was like, okay, I'm not messing around anymore. I need to do something and change. Because getting that test result back from the clinic that tested positive for all of these substances and my pregnancy was one of the most shameful experiences that I've ever had. And I don't want to experience it ever again. And so I decided that I needed to change. And I delve into researching how to minimize the effect of methadone on my baby. And so I spent the next 9 months changing my life, the way that I live, the way that I do things, changing my relationship with my significant other, seeing what I needed to do to change for long term, because I wanted to give my children a different life. I wanted to break the cycle, because my mom, my biological mom, is just like any of my other patients or myself. She just didn't have the support and the need and the resources that she needed to be the best mom that she could be. And so I devoted my existence to figuring out how to minimize the effect on Gracie, my daughter, my first daughter born. And I went through my pregnancy doing what I know best. When I talk about privilege, I also mean I was college educated, so I'm able to research and advocate for myself. And I was able to learn the best ways to soothe baby and how to reduce the effects of methadone, skin to skin, breastfeeding, baby wearing, all of these things that create confidence in a mom. And when I got to Magee in 2016, it was January 1st, 2016, I was full of hope and I was confident. And I knew what I needed to do to support my baby and to be the best mom I could be. But I was met with stigma, and I was met with judgment when I went to the hospital and told them that I was on methadone. The first thing the nurse said to me was, well, honey, you don't look like somebody who'd be on methadone. And I just said to her, I didn't say anything, but I thought in my head, like, what does that even look like? And why are you saying that to me? And throughout my entire pregnancy, I knew that I wanted to stay with my baby, and I kept asking everybody what was going to happen. I know she has to go through this observation period, and no one could give me a real clear answer. And those 9 days that she spent in observation, I killed myself to be there. They didn't have a nesting program at the time, and so I had to get a hotel. I was able, thankfully, to afford a hotel next door, right, and all the meals out. And I was visiting my daughter, and no one else was in the nursery, and I didn't understand why. And I realized that women were actually sleeping in their cars to be able to visit their baby. They didn't have space for them. And so that was like the most traumatic 9 days of my life. And being separated from my baby, not only being separated, but the trauma from why we were separated, why she needed to stay, and why she was uncomfortable. And so I learned 2 things in that experience. One was I was not going to be able to taper off methadone before my childbearing years were over. I was in mid-30s, I had tried tapering in the beginning of my pregnancy because I thought less methadone was better. That's not true. It's actually the consistency of dosing, not the dose itself. But I learned that it was going to take me a lot longer, and that I wanted to have more children. I've always wanted to have a big family, and that I wasn't going to rush myself and I wasn't going to push myself, because the last time I did that, I had a reoccurrence of use. So I decided that I knew that I was going to have more babies, I was going to be on this medication, and I did not want to have the same experience. And so I started researching what doctors at Magee, and I wanted to go back to Magee. I love Magee. I love my care there. I loved my doctors. I wanted to know what could we do better, right? And so I looked for research, and I found Dr. Elizabeth Kranz, who's the medical director of our program at Magee Womens Hospital at the Pregnancy and Women's Recovery Center. And she does a lot of research supporting women and championing for women who are on medication for opiate use disorder. So I found her email, and I wrote her a letter, and I said, what is Magee doing to keep mothers and babies together? And here is all of the research that I have found that shows that keeping mom and baby together, and my own experience as well, my daughter scored lower when I was there with her, shows that it reduces the symptoms of NAS and shortens the hospital stay. And so I am just so thankful for the people that listened and read that email and were impacted by it, because it was instrumental in developing our nesting program. And this was in 2017. So I actually wrote this letter before I even got pregnant, because that is how traumatic the experience was with Grace, that I could not even plan on having another baby until I knew for certain what was going to happen at the delivery. And that's when I found that they were opening their parent partnership there at Magee, and that I was able to stay there with my daughter Charlotte in 2018, and then Josephine in 2020. My two daughters did amazingly well. They stayed for 5 days, and they came home, and it was incredible. And I saw them do so much better, and it was just totally night and day. Before I felt alienated from my child's care, now I felt like the leader and confident in my daughter's care and recovery, and I was like, made that contact person. I was the main person. I was the person that could soothe her. And so that was before I even had a job at Magee. And so unbeknownst to me, when my daughter turned a year old, I reached out to the program, and I had met the peer navigator that worked there at Magee, and I told her that we were doing well, and she said, we have a position at Magee open. And so I said, absolutely. I had no idea what I was getting myself into. And at this time in my life, no one knew I was in recovery or that I was on methadone, or on this medication. So it was me and my partner that knew, and no one else. No one else. So in taking this position, I was also sort of kind of putting myself out there. And I have learned to recover out loud, as they say. And it's helped me find confidence in this job and having this role. I think working for Magee really does give you some confidence to say, hey, I'm on methadone too. But I find that to be instrumental in changing the way that we work with our patients, is the fact that I'm actually on this medication too, and that I'm actually able to develop this trust with them. I've been tapering for the past 5 years. And it's something that I do very slowly, and it's personal to me. And if I have to be on this medication for the rest of my life, I will be on this medication for the rest of my life. It has absolutely saved my life. It is the best thing that I have ever done. I would have told you it was the worst mistake I've ever made, maybe 6, 7 years ago. And at this point in my life, it's one of the best things that I've ever done for myself. So really, I just wanted to share, how I got here, and I'm very passionate about advocating for our patients and changing the way we view people who have opiate use disorder, who have substance use disorder, because I have not met one single mother that does not care about her children or her babies. I have met a mom that is too afraid to stand up and say, I am a good mom and I have an addiction and I'm in recovery. That's very difficult for somebody to say. And oftentimes it's easier for them to shrink up into a corner and not fight than it is to stand up and be confident in themselves as a woman who is in recovery and who is on a medication for opiate use disorder. And changing the way that we see these people and that we know that they're in recovery and that they are in treatment, and looking at this medication more like a mental health medication than a replacement. And that is why we don't call it MAT anymore. We call it medication for opiate use disorder, and we changed our language and the way that we talk about these things. It just goes so far. And so I just want to thank everybody for having me here today. And I do want to ask if anyone has any questions. I'd really be happy to answer them if anyone has any questions. Yes? Yes.
Hi, thank you so much for
Sure.
fairly confident I can speak.
Thank you.
I'm curious if your time at Magee, from the stigma that you felt from the nurses,
Yes.
if you've seen a change
Absolutely.
in that? Okay.
Yes.
Yeah.
Absolutely. So, and sorry, I did not mention that. Yes. In fact, Magee's entire culture has truly changed. Not just since me writing the letter and having our parent partnership opened, but since they hired me, and since it's made such an impact on all of the employees that work there. To hear my story, they give me the opportunity to share my story with all of our colleagues and our employees, and it's so impactful, and that's why I'm so happy to do it, because I do see such a shift in the way we do things, and harm reduction. That is like my biggest thing, is harm reduction, and that means respecting everybody's path to treatment, regardless of what that looks like. Thank you guys so very much. Thank you. Thank you. Thank you.
Thank you, Cam, for the generosity of sharing your story with us, but I think more importantly, the generosity of sharing your story with the women who it will really help. And I think I can speak for the whole group when I say we really admire and respect your strength. So just thank you for being here. This was just tremendous. You know, it's tremendous to be together, but it's also tremendous to be in a room with folks who are so committed to helping other people. And it's very special. I think it's something that those of us who are in organizations like we're in, or who partner with organizations or support organizations, really appreciate. So thank you all for being a part of that. Thank you to our sponsors. I think I saw Yvonne Cook come in. Is Yvonne? I see Yvonne in the back. Hi, Yvonne. Yvonne is president of the Highmark Foundation, so I want to give her a shout out. And she's another buddy. We don't even know when we met each other. So our next event will take place in October, and it will focus on how social determinants of health affect access to breast and cervical cancer screening and care. And of course, as we all know, all of these issues that we're talking about and dealing with are all tied together. So we'll continue to work on making that safety net as strong as it can. And we will be getting you more details. Again, let us know if you have any ideas or suggestions. Thank you, everybody.